After South Africa announced the discovery of the Omicron variant, Canada and other countries were very quick to bring in travel restrictions. But was South Africa unfairly targeted in all of this? The South African president says yes, that the bans are wrong, unfair, and punitive. And today he said he wants to see those bans lifted before it leads to massive damage to their economy. Check this out.
There is no scientific justification whatsoever for keeping these restrictions in place. The rich countries of the world need to support the efforts of developing countries, economies that is, to access and to manufacture enough vaccine doses for their people without delay.
Even Dr. Theresa Tam, Canada's Chief Medical Officer of Health, regards the travel bans as, quote, performative. For example, the 2 cases reported in Ottawa traveled from Nigeria through Montreal's Pierre Elliott Trudeau International Airport. Nigeria not on the list of countries Canada imposed travel restrictions on. So with Omicron already in Canada, is the travel ban on South Africa and other countries effective? And could the Globe's reaction to South Africa lead to a chilling effect on future reporting on new variants of concern? Joining us now is South Africa's High Commissioner to Canada, Sibongiseni Dlamini-Mnambo. High Commissioner, good to have you on the program. What is the reaction of your country to Canada's travel ban? Is that fair?
Good evening. Our feeling right now is that any sane person is questioning the irrational and illogical harsh move that has been taken not only by Canada to ban South Africa and including its neighboring countries in the Southern African region. South Africa should actually be applauded for its sophisticated medical research capabilities. These superior research capabilities by the scientists in South Africa were refined actually during the unfortunate HIV/AIDS era and are today proving to be very useful during the COVID-19 era. Look, as a nation, South Africa is committed to multilateralism and in the spirit of Ubuntu, the spirit of working together and finding solutions to combat the pandemic. South Africa immediately reported to the World Health Organization, and we shared the detection of the latest variant with its numerous mutations to the spike protein. Now, the variant which is now referred to as Omicron. That country that shared openly with the global community after going a step further in practicing genomic surveillance. Unfortunately, a country which has displayed the highest levels of transparency and integrity is now being demonized for doing the right thing. We now know that...
High Commissioner,
yes.
Let me just ask you, High Commissioner, I totally appreciate what you're saying. South Africa was transparent. We just talked to the WHO about this. By the same token, is it prudent for countries to say, I'm glad you're transparent, but there's no corollary between protecting our citizens if they believe a travel ban is effective and transparency? Do you blame other countries for a travel ban?
This is happening is really a knee-jerk reaction. The entire world needs to understand that this is a crisis. We need to share information. And for South Africa to be sharing this information, it's hoping that the information will be used to find solutions. But instead, the borders are being closed. It's really a knee-jerk reaction. It has no scientific basis. So it just, we just don't understand what is happening.
What is your message right now to Mr. Trudeau and the Canadian government on this issue as they're grappling with the arrival of Omicron? There's fears about it. I understand there's also a vaccine equity issue, and we've just spoken with MPs about the South African call to drop the patents on and to let countries like South Africa produce generic vaccines, as you referenced with the HIV issue. But what is your message about the travel bans to the Canadian government?
I think, like I said before, we heard from Dr. Mike Ryan, very recently the executive director of the World Health Organization, who deals with emergency programs, who said countries have to stop taking knee-jerk reactions. Here, I'm not going to talk about a particular country, but I'm talking to countries that have banned South African people traveling from South Africa to really look into the matter. What is even more disturbing is that we all know today that this variant has been picked up in quite a number of other countries. Countries like Hong Kong, the UK, Belgium, Israel. But these countries have not been banned. It's only South Africa and the neighboring countries. And if you think about it, Swaziland, for instance, Zimbabwe, Lesotho, some of the countries which have been banned, they have not reported any of this Omicron, but they have banned. So this is very disturbing.
I have about 10 seconds, High Commissioner. What does that tell you? Just do you have any opinion as to why it's the Southern African countries and not other countries that have already had confirmed cases of Omicron, they have not had a travel ban? To what do you attribute that?
To be honest with you, we are still puzzled. My minister will soon be talking to Minister Jolie. She has requested a meeting to talk because we are trying to understand why Southern Africa, why a country, for instance, South Africa, that is contributing so much towards this pandemic in terms of research. Why are we being punished? That we are trying to, we just don't understand what is happening. And it's even more unfair, like I said, the countries which also have reported this variant, they have not been banned. I don't know what we can contribute this to, but we hope very soon we will know.
High Commissioner from South Africa to Canada, Sibongiseni Dlamini-Mnambo, thank you very much, High Commissioner, for joining us. I appreciate it.
You're welcome. My pleasure.